This is a very special video because I'm not in Germany anymore. I'm in Denmark, in Esbjerg. What am I doing in Esbjerg? Well, I'm visiting a colleague and she's going to tell me and to tell you how she's dealing with Peyronie's disease. And she has been to America and she has been doing some research on stem cells and how to inject stem cells into Peyronie's plaques. Dr. Majken Højrup-Wiborg, welcome to UroChannel. I'm so glad that you could make it to give us some insights into your work, what you're doing here at Esbjerg Hospital. So if you just could introduce yourself, you're a urologist, right?
Yes, I'm a urologist. I became a certified urologist in 2014 and I became a sexologist with a master in sexology in 2017.
Really?
And I've been an MD for 20 years now.
Okay, so you got a special interest into Peyronie's disease because this is today's topic that we want to talk about stem cells, how to treat Peyronie's disease. When did you first get an interest in this disease?
Well, during my specialty in urology, it started in 2009. I just met these men who were very frustrated. I thought it was a larger and larger group that were not too keen on having the operation. And I, as the on the opposite side of the table, to offer the treatment, I was also frustrated of not being able to offer them anything else. Later, when I got my education in sexology, I also realized how many other problems these men experience, like the depression part and the part of a different experience of their own sexuality, not feeling men. And I felt, well, in the start a bit sorry, but also I felt that we really needed to focus on this group.
I am treating many men of this kind too. And my experiences are that many don't want an operation. So many shy away from being operated. And when I talk operation, because according to the evidence and according to the guidelines, operation is the only thing that's effective. But still, people don't want to be operated because the penis is getting shorter and there's a curvature. Is it the same in Denmark?
It's exactly the same. Well, I think there is a smaller group that have the diagnosis, you tell them about the treatment possibilities, and when you tell them about the operation and that there's a shortens and there may be some difficulties afterwards, they say, okay, no worries, I just want it to function. And that's good. It's not a bad operation. It's good for some people, but I also think that there's a very large group that doesn't want it, especially because of the shortening. They think, oh, no one is ever going to touch me in this part of my body for an operation. I don't want that. Even though they may have a curvature of, 80, 90, 100 degrees, which makes it impossible for them to be sexual active, they would rather opt it out.
If we talk about Peyronie's disease as an infrequent disease, like if you're looking at the literature, it says, well, it's a rare disease. And I also find articles in journals of rare diseases. But do you think it's a rare disease?
Not at all. No. I think I usually, when I write the articles and the ones that I refer to, I use like 49%. And I think that's more accurate. And I think it's a stunning, when I looked up how many had diabetes in Denmark, it was like 4 to 5%. And so having Peyronie's disease in 4 to 9%. And it also hits men. I just saw a man last week and he was just like, I've never heard of this condition ever. And it hit me, but what is it? And that's how they experience it. It's very hush-hush.
It's the greatest of all taboos.
Yeah.
Even in TV, they easily talk about erectile dysfunction these days, but no one talks about Peyronie's disease. It's just like it's non-existent.
I think it's because, it's easier to talk about erectile dysfunction. I think that happened after 99. We got the Viagra because now we had a possibility to help these men. With the Peyronie's disease, we only have the operation, and as men are not too keen on that, maybe we don't want to she had too much light on it because we really don't have a good treatment for it.
But now it's stem cells. So you got an interest into stem cells. Why stem cells?
Yeah, good question. Well, I never saw myself as a scientist, but when I read some articles, it was actually animal research on Peyronie's disease, where they published in 2013 stem cells that they had from adipose tissue. And they gave them to some rats that they have given Peyronie's disease. And the results were just really astonishing. I mean, I know it's animals, I know it's on another level. You can't translate it into human. But more studies came, and they all both looked, the Peyronie's disease had the acute phase and the chronic phase. And in the beginning, they looked at the acute, which was, well, we hardly ever see anyone in the acute phase, especially not in Denmark, because we've told the GPs that we don't want them in the department of urology till they're in the chronic, because we will not do anything anyway. So that's when we see them. And later they did the animal research also in the chronic disease. And what they showed is that, around the corpora cavernosa, you have the tunica albuginea, which is an elastic layer. And it consists of a bit of elastin and collagen. And what happens in the disease is that you see a shift. You have collagen 3 and 1 types, and there is a shift. So you have more collagen and deposition in that. And where the tunica albuginea before was elastic, it comes inelastic, and that's how the curvature appears. So what they see in these animal studies, where they inject the stem cells into the area of the scar tissue, is that it shifts back to more normal-looking tunica albuginea. It shifts back to the collagen deposition disappears. And they don't know really how they do it. There are certain theories, but that's just the effect. It's more effective in the acute animal model than in the chronic, but there's still an effect.
I've been thinking about stem cells myself, of doing it, but the problem is there's an operation involved, and you really have to put people in anesthesia, and then you have to get the fat from the belly. Plus, it's the most easiest way to get stem cells from the fat, but you could also take it from bone marrow, and you could even take umbilical stem cells from somebody else, I would guess. So it makes it more complicated in terms of more complications. But PRP, like platelet-rich plasma, would be another alternative, and I'm doing PRP, but it's not the same, isn't it?
No. I have met patients in Denmark who said, I tried stem cells. The doctor gave it, he took a blood test, and then he said he gave me some stem cells. I was like, that was not stem cells. But yeah, I don't know how, I think they may be making it more easy to explain, but it's so wrong. Well, we don't really know how platelet-rich plasma acts either, but they think that they recruit stem cells when injected. So it's another passage. But honestly, we don't know enough about that. And I think my personal opinion is that you should really only use PRP in protocol trials so far, because we don't really know. I just did a major scoping review, and on the animals, the PRP made more fibrosis.
I think it depends. If you have a look at PRP, there is no standardization either.
No.
And the problem, which I was thinking very much about the white blood cells, because if you have leukocytes in the PRP, it may trigger more fibrosis. So the question is, in these animals, did they add leukocytes, or did they do it?
No.
Because you can tailor-make your PRPs like you want them to. And the question is, in the stem cells you are injecting, is it just stem cells because they're delivered in some kind of fluid? So are there any growth factors in that fluid? Do we know anything about that?
There are growth factors, yeah.
So it would be similar to PRP then?
They have some of the similar additional things, yes, they do. They do. I think there are, to some extent, similar, but you cannot call PRP stem cells because they don't.
No, they're not.
There are no stem cells in it. But I mean, I'm very excited about PRP, and I really hope that it will be a helpful treatment for the men, because it would be, as you say, so much easier than without the operation.